How about patient in Unit 5 happens to be one of your people from San Diego.
In what?
He was the first one that got in there. And I just left you a message about it, so just check the message later.
Okay.
Just check it in.
Hello, Luna.
Okay, Luna, I got you, buddy.
Hit the mute sign now?
Pardon me?
Do I hit the mute button now?
Yeah, just hit it until you're going to talk. Keep it quiet in the background. Anybody else checking in?
Yeah. No, I'm in a one-man room, so I don't think I really need to hit the mute button.
No. Anybody? I didn't hear you checking in. What's the name again? Or what unit? Just tell me what unit.
Unit 24.
What unit?
24. I mean 23, I'm sorry. I just came 24 last night.
Oh, yeah, Luna, I got you, but somebody else came in too. Who else is that? Anybody else want to check in?
Yeah, Sam, it's me, David. I'm unit 20.
Oh, right, David. Good deal, buddy. Thank you for showing up. Well, I'm going to get started. These other guys will check in. I know they're going to be there. They're just a little bit slow. All right, guys, good afternoon. My name is Sam. The reason for this hospital-wide conference call is because of several requests I've received from various attorneys throughout the state wanting to know what's going on here at Coalinga State Hospital. Several attorneys have been working on our behalf already, trying to protect us from staff who are not doing their jobs. As you all know, all of our current problems are the direct result of having a totally incompetent executive director running this hospital and an acting director of DSH in Sacramento who is even less qualified to handle her job. And if we don't get some lawyers out there to help us and become more involved, our lives are going to remain in grave danger. We're going to make a record of most of our current problems and make this conference call available to Senator Caballero, Governor Newsom's task force, and any other lawyer that wants it, including, and we're going to include Barbara Koppel, who did the investigation of this hospital not too long ago. She doesn't have time to listen in, but she's going to get a copy of the recording afterwards. If we are forced to rely on Brandon Price and Stephanie Clendon to protect us from this virus, we're in big trouble. As each unit gives their report, please be sure to state whether or not staff are cleaning their units every 2 hours per policy. I think Joel will touch on that a little later on, and whether or not staff are wearing masks throughout their entire shift. They don't understand that they could come into work and not have any symptoms and carry this virus. This is why they have this rule. They have to wear the mask all the time they're here. They need to get it through their heads. They're going to do it. If they don't want to do it, they can go home. They can go work somewhere else. But they're going to wear the mask while they're here. We're not going to stop until they do. And they have to wear it through their entire shift. We also want to put on the record about how impossible it is for us to be socially distanced in this hospital per CDC guidelines during the pandemic, because hospital administration still has not provided us with proper TV reception in our rooms so that we can isolate ourselves in our rooms. Right now, we're forced to come out and watch the news to learn anything about the virus, and that's if we're lucky that the bullies let us watch the news. We're also going to put it on record about the warehouse. Getting a lot of reports about the warehouse, and lawyers out there that are listening are going to want to know about this. Under direct orders of Brandon Price, at least that's what I believe, the warehouse is sending hundreds of packages back by falsely claiming they're 2 or 3 pounds overweight. One case was couple ounces overweight. And they're lying. They're not overweight. They're making that up. And we're going to get that on a record because I know there's lawyers out there that are going to be listening, and they're going to want to do something about that. And they're returning packages without notifying the patients, which is causing a lot of stress at a time when we don't need any more stress than we already have. So let's get started. Anyone who has to speak up, I will know. I know two people. I'm going to go to them first, and so that they're cleared, so they can go to their second appointment. So, unit number 1, are you there? Unit 1. All right. How about unit 11?
17's here.
Yeah. Oh, 17 finally showed up. Good deal. Kurt?
Mick, huh? Yeah.
Good deal. Thank you, Kurt. Appreciate it.
Yeah.
Anybody else want to check in?
Yeah, Mick. Unit 4.
Unit 4. Mick. Thank you, Mick. Again, I'm not going to use last names, even though I know everybody on this call, but I'm going to stick to first names. Unit 2. That is a first name. Pardon me?
That is a first name, Mick, Unit 4.
Oh, okay, but maybe I do know your last name. How do you know? Anyways, how about Unit 2? Are they here yet? Unit 1. Okay. We'll come back to those guys in a minute. Paul Cricht. Paul, you're up, buddy.
Doesn't come in very clear.
Paul, number 3, Unit 3. I thought he checked in. Did I miss that? I thought Paul checked in. Okay, well, let's move on. Unit 4, Mick.
Yeah, what?
What we want to know is if the staff are complying with cleaning. Are they wearing their masks in your unit?
You're asking? Okay, no, we have issues of non-compliance as far as the masks go up here. There's people not wearing them when distributing meds at times. And not wearing gloves at times when distributing meds. We have not too bad.
You're on a roof, so are there officers up there? Are they wearing their masks?
Yes, they are.
The officers are wearing their masks. Okay, that's good.
Yes, they are.
Are you guys able to? A lot of you guys can stay in your rooms if you want to isolate yourselves to protect yourself. Are you able to do that easily on Unit 4?
Yeah, as well as we possibly can in a dorm of 4 people. Sure.
Right. You think that unit would benefit if you had
the problem I really see is the feeding creates a congregation of people where they're locked into one area while they're waiting for their food. And
right. Yeah, I've heard that a lot. The feeding times, they had us all crammed into day rooms or whatever.
Correct.
So your unit would, in your area, I'm not familiar with Unit 4, but would they benefit? Would a lot of more patients benefit if they had reception in their rooms? They could stay in their rooms. Would that be a benefit in your unit, you think?
We're able to stay in the rooms and not have to access the facilities, such as the toilet and everything else. It would be far better. But unfortunately, we don't have that. People would be more willing to stay in the room and not crowd into the day room to watch TV shows.
Yeah, that's what a lot of people don't understand. This is not a real hospital. A real hospital has a bathroom in each room. So this is not it's a fake hospital. And a lot of people don't understand that we have to come out. So we're forced to come out for a lot of things. So you're right about that. I appreciate you bringing that point up. Okay, you got anything else to report to Unit 4?
I don't think that we really do, no. Otherwise, I'll give credit where credit's due. The hospital's done a good job of keeping the coronavirus out here to this point. But there are things that we can do in here that would alleviate spreading.
I don't think Unit 17 will agree with you, but I agree with you.
No, I don't think so.
I'm kind of happy that they've done a good job.
And I see what they're doing outside with staff.
Right.
And, look,
we're going to,
we have issues
of this
inside.
conference call is we're going to make sure it's going to stay that way or maybe get better. So we don't have accidents like Unit 17. All right,
once it's in here, you're in trouble. That's the point.
Yeah,
Once it's gotten in here, place, and it has apparently, we are in trouble.
Yeah,
it has gotten in here.
Pardon me?
We had 3 people off this unit test positive.
What unit are you talking about?
Unit 17.
Yeah, I'm gonna get you in a minute. I'm gonna come down to you. Just hold on. Unit 5, are you on the line? Cuba. We really need to hear from him. He had, this boy, he was in 17, and he could shed some light on what they're going, but thank God Unit 17's on the line, so that's good. All right, number 6 is me. I got to say, the staff, I got to be honest, the staff have been very, very compliant as far as the mask. A knock shift, they have a tendency to take them off. That's because they don't understand the virus and how they can bring that virus in here so easily. Some people need to be educated a little bit better. But I'd say overall, my unit has been, has been very compliant. And the cleaning, going by, I've asked the staff, and they're reporting that they're cleaning every 2 hours. I don't know if that's true or not. I ain't got time to sit around and watch them. But U.S. told me that they're reporting doing that every 2 hours. I haven't had enough time to verify that yet. I will at a later time. But from what I can see, Unit 6 has been compliant, although it wasn't like that when I first got here. It is like that now. Okay, unit number 7. Danny.
Yeah, I'm here. So as far as compliance, as far as wiping things down every 2 hours, it's gotten a little better the last couple of days since we've had some positive cases. Before that, it was not very compliant. Masks are being worn in front of the patients pretty much at all. Where they're lagging maybe a little bit is they're taking them off in the offices, and that's a concern because virus can survive on surfaces. Our clean masks are in there. So
they were told not to do that. I don't understand why they were still doing that. They were told to put your mask on, keep it on till you go home. Now, you can go to a room by yourself and eat and take it off, but you cannot do that. And they've been told that they're going to be sent home if they're caught. That they got to knock this off, and they got to understand.
He says over the past couple of days he's been monitoring them. So today they're all wearing their masks.
Well, you have a very good program director in your program, the same as me, and he wants to hear any complaints that we're talking about. He wants to know about it. And
but as far as in front of the patient, they'll grab their mask and come out before they even talk to us. So they're pretty good at doing that. The one area that I do want to discuss is the grill. We were on our unlock on Tuesday night, and they started to make our food without masks on. And I had gone up to one of the individuals and said, no disrespect, but can you please mask up when you're making our food? This individual decided to tell me, just to let you know that we get, they get tested for temperature and all that coming into the facility. I told him that's all fine and dandy, but in reality, you could be asymptomatic and not even know you have the virus, and you're over here making our food without masks on. This is where I think the problem lied with the staff on 17 getting infected. They were probably asymptomatic, not showing signs, came into the facility and passed it on to patients.
Exactly.
So I think
that falls on the administration not making these people, not schooling them well enough. They just don't know. I don't think they deliberately want to kill somebody, but that's what's going to happen if they don't comply with that order. They have to comply.
The real people were very receptive. They put their masks on and continued on with our food.
Exactly. Well, you talk about the grill now. They did put masks on. They kept them on, right?
Yeah, they kept them on throughout the duration of our unlock.
But that was smart of you to get involved and get that done.
On the next unit's unlock. But for us, they
that was good, Dan.
I do have an issue with our personal masks. They're not always cleaning them properly. They're not always in sanitary, bags or kept clean. Some guys' masks are disappearing. There's supposed to be 2 masks for everybody, and not, at least on 3 occasions, I've had reports that they don't have both of their masks. So when they go to trade one in, they don't have another one to give them. So
I've been hearing a lot of complaints about our masks they're not following the rules on taking care of our masks. But I need people to speak up on that, just like you just did, because that's really an important issue. They are not following their own regulations. And we are going without. They confiscated a mask for me this morning because I had the wrong mask on, and she actually took my mask away, which is administration told
and, stop like doing that. He wants us turning them in one-for-one exchange daily. They don't want us washing our own masks. But at the same time,
that's discretionary, and they know it. But if you want to do that, fine. But it's up to your patient. If he wants to wash his own, fine. You don't have to turn it in, and you won't be punished if you don't. Right. That came out from the executive.
Your situation, I don't know if it's related with this COVID or not, but I will admit that we have had 4 packages that I know of sent back, and none of them were higher than 8 ounces over. So it was 0.4, 0.4, 0.4, 30.8. And all those packages were returned, and all four were from vendors.
Well, the reason why I want this on the record is because we're under a lot of stress as it is. We don't need more stress. And they sending our packages back without letting us know, and then sending them back for falsely saying they're overweight is costing us a lot of stress during this pandemic, and it's got to stop.
I have brought this issue up with US's until I'm blue in the face. These vendors will not ship over 464 ounces no matter what, and some of these packages aren't even 464 ounces. Some of them have been 449 ounces, 451 ounces, and when they get to the warehouse, they're coming up 30 pounds, 4 ounces, 30 pounds, 4 ounces, and they're sending them back. So on 4 occasions, they've been 8 ounces or less, all from vendors, and returned.
Unit 7 has a new US, and I know her. I think she will help in that regard. She's a good one to go to.
Actually, her and Ken switched because Unit 5 was activated on Tuesday, so we have Ken until the end of the month, and then I heard we're getting Maria Serrano.
Oh, okay. All right. Sorry you guys got Ken. All right.
Actually, he's been helpful last couple of days. Believe it or not, he's actually been helpful.
I think Ken, I know, some people like him, some people don't. But you can work with him, though, in most cases.
Yeah, I got no problem.
Okay, Unit 7, is that it for you?
Yeah, that's all I've had.
Okay, thank you, sir, for your time. Unit 8, Tech, you on the line? Unit 8, Tech? Okay. How about anybody up in 1, 2, 3? Are they here yet? Units 1, 2, and 3, are they on the line yet? Okay. Pretty sure Unit 1 had to go to court. He'll be joining us shortly. But nobody from Unit 2 yet? And Paul, you on the line yet? Okay, let's move on. Unit 9, are you on the line? Earl or Burkhardt? Okay, how about Unit 10? Unit 10, are you with me yet or not? 11. Okay, they'll hopefully join us in a little bit. I'm going to move on. Unit 12.
Yeah, this is Larry. I've only seen one person today without a mask. Everybody else, the cops and everybody's been compliant.
That's good to hear.
No sickness up here. I don't know what else to report.
Are they cleaning? You notice if they're doing their cleaning?
Yeah, I wanted to say something about that. The staff's not cleaning, but everybody that worked on the kitchen crew, there's like 13 of them, is wiping down before breakfast, after breakfast, after lunch, and before and after dinner. They take turns and they wipe down the whole freaking place.
Oh, okay.
And there were people wiping my doorknobs all the way until 8:30 at night. So I don't know if staff's even necessary in that case. It's being done.
Right. Well, we just want to make sure it's getting done. And Unit 12, your unit is one of the better units for reception, but you think you would still benefit if you had a TV reception in the rooms? Do you think your unit would be better?
There's like 8 dorms in here that get reception.
Right.
All the rest of them.
Okay, that's good to know. I thought it was the other way around. So again, we're not able to isolate ourselves because we don't have anything in our room to do that with, thanks to the administration dragging all these years and not providing hookups like you do in prison in all the rooms.
Okay, I don't think their goal is to have us watch TV. I think their goal is to have us sitting in our room doing treatment.
Well,
so I don't think that's
let me clarify.
Far, but I wish
my goal is not just to watch TV. My goal is to be able to watch MSNBC and CNN and educate myself as far as this pandemic is concerned. Right now, a lot of people are ignorant. They're not wearing masks because they don't know that it's to their benefit to wear a mask. If they would watch MSNBC a little bit, and even sometimes Fox News once in a great while will even give us some information. But there's TV stations that are on all day long that these guys are not getting because we don't have it in our rooms to watch it. And nobody wants to fight various bullies. They want to be able to watch the news during the day, and they're not able to. That's why we need to have reception so we can educate ourselves in our rooms like they do in prison. Okay, Unit 12, anything else?
No, that's it.
Okay, Unit 13. You're up, buddy. Norm and Stephanie, both of you. You're both up.
This is Norm.
Okay, you gotta get the phone closer. I can barely hear you, Norm.
All right. A couple things. Let's start with the package thing. We've had this issue for a long time that the scale that they use is a 1 foot square scale. And when they put a package on it, if it's got any amount of weight, like, let's say, coffee, on one end of the package, it doesn't weigh it properly. We've asked them to change that scale out at the warehouse multiple times to a scale that's at least 24 inches square, and they refuse to change that scale. If they would change that scale, we would have an accurate scale out there. There's not an accurate scale in that warehouse. That's the reason we keep having these problems.
Right.
As far as other issues, we have multiple issues regarding this lockdown. One problem we're having is we have Unit 17 across the hallway to us. They've had a couple codes on Unit 17. Our staff respond to Unit 17. When they return from Unit 17, they don't change their mask, they don't change their gloves. We have pointed this out to them. They said, we're going to respond to that unit. We ask them to wash their hands, change their masks, change their gloves when they return to our unit. They refuse to. We have staff on our unit that have told us we wear the same gloves all day long. We go through the laundry, we respond to a code, and we serve your food with the same gloves on all day long.
So
we're also
there's a lot of cross-contamination. Yeah, somebody else brought that to my attention yesterday.
Okay, if they're responding to a code with the quarantine unit and they're coming back and serving food to patients wearing the same gloves, there's a problem.
Yep, I agree.
We also have staff that say that tell us openly, we hope everybody gets it, and you guys is going to die off, and then we can go ahead and have our lives and move on.
Yeah.
That's the attitude of the staff on these units. They want everybody to hurry up and get this thing. They tell us this daily. That's the attitude.
It's really a wonder that we've been so successful because I agree, they do want us to, the way they're acting.
They want us to hurry up and get it over with.
Yeah.
And we've got staff here on our unit got the attitude that let's hurry up and get this thing and let's go ahead and get over this. And they're basically, we have no enhanced cleaning on our unit. They've locked our kitchen workers down to work 45 minutes a day. That's all they get to work.
Wow.
The kitchen workers come out, like at lunchtime, they come out at 12 o'clock and work to 12:45. They pick up the trays, they wipe off the trays, they put them in the carts, they wipe off the day room. That's all they get to work. It's 45 minutes.
Who's
so
your
they're
unit?
not doing any
hands clean.
Norm?
Huh?
Who's your U.S.
What's
13?
that? Yeah. Renee Pierce is our U.S. is Amanda Wood, but she's in program because she was out for surgery and she came back. She's light duty. So Renee Pierce, which was on 16, has been our U.S. now for 3 months.
Okay. All right, I just want to get that on the record.
She's moved, the patient she doesn't want on her unit, she's moved down here.
Right.
And we've had, as far as our phones, we've got 3 broken phones right now that don't work. The numbers don't work at all. And the only outlet that our guys have got is being able to talk to their friends and their families.
Right.
And we have been trying to get phones fixed down here for this whole time, this whole pandemic. We can't get phones fixed.
And you just reminded me of something, too. They're not providing the green wipes that are effective with this virus. They're not, they should be having those in the day room during this pandemic, and they're not doing it.
And then the other thing, staff has taken a pay cut, and they've got their attitude.
Okay, anything else, Norm?
Yeah, Stephanie just pointed out another point. Because the PsychTech's union just signed their contract and took a 9% pay cut,
yes,
they're taking that out on the patients, and especially the patient workers. They're complaining about the fact that the patients didn't take a pay cut, but they should be taking a pay cut too. And they're really harassing the patient workers because they're making $7.25 an hour when the PsychTechs just took a 9% pay cut.
And they're making threats about taking their jobs for things that aren't job related too.
Oh, if you have any behavioral issue at all on my unit, the first time's a warning, the second time's a 30-day suspension, the third time they take your job permanently.
And Sacramento, I know, told your staff and Program 5 to stop doing that almost a year ago, and they're still doing it.
They do it all the time. First time is a warning, second time is, and the thing is, your first warning can be prior to the $7.25 an hour. If you had an SIR before the $7.25 an hour, that was your first warning.
And again, why this is so important is because they're increasing the stress level when they should be trying to reduce the stress level.
Well, I see on TV where the governor has got the Surgeon General talking about the importance of maintaining positive mental health through the pandemic.
Yeah.
We have psychologists on every unit. We have 50 patients on units, and the team psychologists are not coming out of their office to see how people are coping with this pandemic. How are you doing? How is your family doing? Do you need anything? They're not doing anything. They're not reaching out to help people during this stressful time.
Yes.
If anything, the teams are creating more stress.
Yep.
And we have staff floating from other units, and especially from units that are on quarantine.
Wow.
We had 2 staff that floated from our unit to 17 and then came back over here. And they're responding to alarms. They're going next door. And we got one staff that says, I got friends that work over there. Sure, I go over there.
Wow.
When there's an alarm, he goes over there. You remember when we had like the neurovirus when the staff were told to go through the back and change their shoes, wash their shoes, and put on PPEs and all this kind of stuff? They have no protocol right now for this neurovirus. They're not washing their hands. They're not changing gloves. They're not changing masks. They're just walking in and out the front door anytime they want to. I am shocked that we haven't got it across the hallway over here yet.
I'm surprised that most of us are alive, to be honest with you.
I am surprised. The way my staff keep going back and forth across the hallway, I'm surprised we don't have it.
Well, we're going to try to do something about that.
And 17 staff are responding to other units' alarms. If there's an alarm, Unit 17 staff is responding.
Well, we're going to try to do something about it.
We have some major concerns about you know, the way the staff respond to codes, their attitude about, you know, generally let everybody get sick and die. There's no enhanced cleaning on our unit at all. Zero. Staff are not doing any enhanced cleaning. Not letting the kitchen workers do enhanced cleaning. Windex in the towel to wipe off doorknobs, and they require that the patient janitorial workers work 1 hour 2 different times a day. Yeah. That's the only time the doorknobs or the unit gets cleaned. Oh, so twice a day the unit gets cleaned. That's it. Anyway, that's all we got.
All right, Norm. Thank you, Stephanie.
Yeah, he just plugged it in, that's all.
All right, move on to Unit 14. Are you there?
Yes, I'm here.
Okay, can you speak up a little bit, please?
Yeah, I'm here. So I have personally witnessed staff not wearing PPEs in patient areas, such as the day room, while interacting with patients. They have been not wearing masks, gloves, and hairnets while passing out our food, and on multiple occasions while dispensing medication. And we all know that the human breath puts out water droplets, and they've been talking to patients while doing it, while dispensing meds. So there's they've been haven't been in compliance with doing any enhanced cleaning. The days have gone by where I've noticed psychiatric technician staff on Unit 14 fail to do regular cleanups. They haven't been doing doorknobs and surfaces for days. Every so often they come out and make a big show of it and do it, but days have gone by where they don't. So it's abhorrent. It's appalling that they won't come out and do it for us. They let the patient workers, like on 13, how they were saying, come out twice a day, and they give them an hour pay, or 2 times a day to come out and give them a little bit of a rag and some Virex or disinfectant. They can do their job like that. But for them to come out and do it, they haven't been doing no enhanced cleaning. And social distancing is not possible on a unit of 50 people, where 30 people want to go in the day room and watch TV, to watch the news, to become abreast of the situation with the COVID. And because TV reception is not an option in our dorms like in prison is, where they have TV reception in prison because they have the hookups. And it's been a constant struggle to serve meals in the unit population where we're all crowded in a little hallway. So they're trying to serve chow in the day room, and no matter where you try to serve us, it's congested. So it's too much of a confined space to observe social distancing. It's crazy. And
have you seen anybody from the administration walk around your unit to view the situation recently?
No one from administration ever comes over here.
I'm talking about Brandon Price,
administration comes over and checks on us. It's like they just let us float on a raft in the middle of the ocean. We're an island. So they just let the staff here do whatever they want. I mean, I can give names of staff that do whatever they want. One of them in particular didn't wear gloves or hairnet or mask last night to serve a meal, and said that she could do whatever she wants. She wasn't wearing any PPE while serving our meal. And said, when it was brought to her attention, she says, "Oh, whatever, I can do what I want. Either you eat or you don't. I don't care."
And if Francis Hicks or somebody in the administration were to come and ask you who that person was, you would be all right letting them know, right?
Yes, I would. My name is John Valdivia.
Okay. Yeah, they're going to comply. They're going to comply, or they're going to not work here. They're going to comply.
That's fine. My name is John Valdivia. I'll tell them on it. Hey, so the packages, there's been a couple people where 2 people in general have had packages that left Walking Horse that were 28 pounds. Upon arrival at CSH, those packages were all of a sudden 31 pounds. One other person had 2 packages that were sent back to the vendor without being notified. Another man had a package sent from Walking Horse that was under 30 pounds, but the weight protruded the sides. So when it got here, they measured it, and they said it was oversized because they were measuring it from the middle.
Right.
So they're saying it was protruding outwards, and it was oversized. Those are shady practices.
It's almost like they're trying to make us lose our vendors, kind of, huh?
Right, because if they keep sending it back, the vendors are going to say, well, we just don't want to do business with that hospital no more. Yeah. I mean, that's not right. That's not fair to us and our family. Our family's spending money on us for things we need. That's not fair to us or our family.
Yep. Okay.
Something's got to give.
Yep. That's all I got. Thank you, John. Appreciate your time.
You're welcome.
And next up is Unit 15. Are you there?
Yes, I'm here.
Okay, you want to report, please?
Yeah, when it comes to the mask and the staff, I'm going to say it's hit and miss. A lot of the staff, when they come out and they're around us, for the most part, they wear their mask. This morning, one of the nurses wasn't wearing her mask. When I went to get blood draw taken, your program director wasn't wearing his mask. Tom Pena was not wearing his mask today.
Tom Pena?
Yes. Not wearing his
mask. Sure it was Tom
today.
Pena? Because I don't think he's here today.
It was Tom Pena. I know who Tom Pena is. White hair,
Okay.
wears glasses.
I'll verify that later. But okay, but I was told he only works Monday, Tuesday, Wednesday. But I'll double check that though.
He was here today.
And I've never seen him without a mask. For the record,
without a mask.
And if you're saying you saw it, then I'm not going to doubt you. I have no reason to doubt you, Robert.
Also, I seen one of the staff persons. She was cleaning twice today. I seen her once, and another person seen her clean earlier today. So, but they're supposed to be doing it every 2 hours. And she only cleaned doorknobs.
Have you ever witnessed your unit supervisor walk around without a mask?
Yes, he was in the. I reported to you the other day about him being in the med room without his mask on.
That's why I asked the question.
Yes.
And did you report that?
Yes, I did.
Okay. All right.
Yes.
And
the staff, when they're in the med room, for the most part, it's hit and miss.
Right.
For the most part, they don't wear their masks. And now the officers, when they're in the office, they don't wear their masks. But when they come to talk to us, they put their mask on.
As far as social distancing, would your unit benefit if everybody had reception in the rooms, they could isolate themselves?
Yes, I would say yes. You know, and when it comes to social distancing, I'm going to say when they feed us, it's impossible to have social distancing. Because we have to come out here and stand in line, and they got to feed us, hand us our trays. You got 50 guys coming out here, and it's like feeding cattle. You got to come through a chute, the doorway to go get your chow, and the guys are pushing and shoving each other to go out there to get their trays.
Yeah.
Yeah.
All right. There's people that I hear a lot of noise in the background.
And another thing that I think is a problem for us is this ventilation system that we have. If somebody coughs, it spreads your cough even further. You understand what I'm trying to say?
Yep. I sure do.
And they don't change the filters on a regular basis. And the ventilation systems are hooked to other units.
Yep.
So if one unit gets the COVID virus, it's spreading to another unit.
Right.
So if Unit 17's getting it, it's going to spread to the next unit next to it.
Yeah, well, anybody that's shown to be positive is supposed to be moved right away, but that doesn't really solve the problem, does it?
Well, it's asymptomatic. People can have it and not even know they got it.
The virus is still there. I see your point.
You understand what I'm saying? Look at what they're doing to these malls. They're putting in these special ventilations, so it's taking it out of the air, right?
Right.
But they're not doing it to this place.
Yep.
So the ventilation system we have here,
do you have anything else?
we already know that, right?
Pardon me?
Ventilation system here sucks already.
Yeah, I
know that. Now that it's got
5, they shut it off.
Building, it's just
they have a separate ventilation over there going on.
Yeah, on Unit 5, yes. But not in the rest of the hospital. So if somebody in one unit in this hospital has it, it's going to spread it to another unit.
Yeah. All right, Robert, is that it?
And somebody else already mentioned the bathrooms and stuff. It's impossible for us to social distance. Like, we got guys out here right now, they're bowling out here in the hallway. Some have masks, some don't. They're not, there's no way to social distance.
Right.
All right, that's it. That's all I got.
All right. Thank you, Robert. Next up is going to be Joel. I think you're at 16.
Okay, I'm over here. As far as it goes, the staff are not doing the cleaning every 2 hours. That's not supposed to just be doorknobs or the tables and chairs and all the common area. That's also supposed to be things like the bathroom stall doors, where the soap dispensers are, things that are used commonly. That is not happening over here. As far as not seeing staff wearing masks in this whole program, units 13, 14, and 15, all of those USs have been up on our unit doing coverage, and I've seen all of them not wearing their mask. Our staff
These are
have a major
supervisors.
problem. What?
These are unit supervisors you're talking about now.
Yes, the unit supervisors.
They're supposed to know better than anyone.
Yeah. Well, they're the ones that are supposed to lead and do the direction.
Exactly.
Going back all the way into probably end of January, I've put in complaints and met with the unit supervisor. I've done it in writing. I've done it all that none of this stuff is happening, and it's not changing. It's slowly changing more, I think, since we got positive cases. The unit supervisor off of 14 in a meeting with me representing himself and program told me that person dispensing the meds does not have to wear a mask per CDC. Now, they're the ones that are handling our pills, what's going straight into our mouth. I do not see them clean things off, even over there, but that's where they're spending, all these hours. The staff on the unit, we have a person who's like the shift lead on our knock shift, our nighttime shift, that, the people are complaining, saying, why aren't you wearing a mask? Why aren't you wearing a mask? And he said, because I had to come out and deal with this. And they said, well, then go back and put it on. And he said, no, and sat down. He said, I'm just going to sit right here then. This is the lead. This is the person in charge, at that time of the night,
Right.
We also have the stress coming from the staff. I've heard a staff, come out of the nursing station, go up to the patient with raised voice, like 2 feet away, and say, shut up, shut up, shut up. I've heard a staff member in the nurses station yelling through the thick windows, and I'm hearing 25 feet down the hallway, her yelling at a patient. Okay? So we're not only getting that, we're getting the stress coming from the staff.
Right.
We had a person on the unit almost every single day. He was making threats, sometimes yelling at the top of his lungs, terroristic threat that he's going to beat everyone up and all these things. Since the beginning of the year on the unit, he's assaulted patients at least 6 times.
But
we finally got him off the unit because the unit got together into the day room so that we could show support. They pulled everyone's level that came out there to show support, saying we can't have him on the unit anymore. And this is negative documentation that's going, against us. As far as it goes, we've been complaining since last year that we're short on chairs. Our day room, if we were to social distance and use the chairs, we can handle 14 people out of 50 at a time. And when staff come in there to work, they take up either one or two of those chairs when they even show up into the day room.
Right.
We have the day room, and we have 3 other rooms. We have a larger group room. We have a quiet room that we can do typing on, and we have a sports room. The sports room's been locked for the last month, and the other 2 are on checkout. We had one that was locked for like a week. They say because the staff does not have the time to monitor those rooms, so they just lock the door, so we don't have that to use.
It makes social distancing even harder.
Yeah, so if we have the 3 common areas, just by the chairs that are there, we can handle the total, excluding what the staff uses. We have a total of 19 chairs. So out of 50, 19 people can be out of their room. Everyone else has to be in the room to do social distancing.
Right.
When we pass out the trays, it's haphazard. You have diets in one line and the regular meals in the other. I get my diet. I have to cut through the other line to get on the other side of them. So we've got 2 lines in a 5-foot walkway area. And this is every single meal, 7 days a week, 3 times a day.
Right.
And the person who had done the assaulting, by the way, one of the people, the last time he assaulted 3 people, put 1 in the hospital. That person came back from the hospital. He's on MA1, which is where they're doing the isolation for the 14 days.
Right.
They don't give him anything personal. All he has is a pen and paper, and the staff refuse to answer the phone because they feel they're too busy. So he can't even get support after he went through this ordeal. But the perpetrator now has his own room and actually has a paying job, which is very rare amongst the hospital.
Weren't you the one that brought to my attention that many patients in the hospital are deliberately refusing to go out to medical appointments because of the punishment that they're going to receive in MA1 upon their return?
Yes, there's a lot of people who are refusing going out to medical. We also have a situation where it's like, I have a situation, okay? They're looking into me having possible cancer, and everything keeps getting delayed. The last time I was supposed to go out for an MRI, and the staff, they don't give us any previous notification. They woke me up at 5:30 in the morning, which is when the van was leaving to go. Just for me to get checked and get assured of that, I'm delayed 5 and 6 months, and this is just since the beginning of the year.
You also brought to my attention about Unit 24, upstairs unit, housing people that are disabled in wheelchairs and also a double amputee. I verified that, by the way. That is happening. I don't know how they're doing it or why they're doing it.
Yeah, Unit 24, they decided to empty out as a backup to Unit 5 to handle COVID cases. So you've got people that might need ventilators that is on an upstairs unit. That goes against the hospital policy. If there's a fire, they can't get them out. Or if there's an emergency because they can't use the elevator. They have temporarily used that for a particular group of the population that have, limited, mental functions and things for a lot of them. And the first 3 patients that they put up there, 2 have walkers, from getting tired easily and being what's called a fall risk. One person they put up there is a double amputee. He does not have either one of his legs in full.
Right. Yeah, so there's a guy on the line who was just in 24. He's going to give a report in a little bit. So he's coming up to verify all this stuff that you're saying right now. Because he was there. He was on 24, and they moved him in the middle of the night last night. So, all right, Joel, you got anything else you want to bring up?
No, right now as far as that goes, but yeah, we're having
Trust me,
staff
there are people
that are creating
either
stress.
listening right now, including Barbara Koppel, or they're going to be listening. This is going to be made available to quite a few people, and so we're going to be heard. Count on that. Okay. We are going to be heard. All right. Next would be Kurt, Unit 17. We sure like to hear from you, sir.
Hi. Everybody's talking about my unit.
Yeah, you're the talk of the town right now.
Huh?
Pardon me?
I said this unit seems to be the popular number.
Yes. Yeah, so what do you know about it? I mean, were the staff wearing masks in there? Were they cleaning?
Since the little labels got put on the door windows, the staff are wearing masks, but they're also wearing the face shields.
Right.
Well, and they don't come out of the office without their face shields and masks on.
How about previously, Kurt? Were they wearing masks previously?
They were occasionally wearing masks. Not all the time. There was a few staff that would do it, all the time, and then there was a few staff that weren't.
Right.
Now,
it only takes one.
We've had cases over here. They seem to be more aware, so they're more conscious of keeping the mask and the face shield on when they're out in the day rooms and in the hallways. When they're in the office, I see them without the face shield and sometimes with their mask pulled down while they're on the keyboards or in talking with each other.
So you witnessed this before the positive results, right?
Yes.
Okay.
And as far as this cleaning and we have one guy that comes around and cleans the knobs on the doors in the morning, and another one comes around in the afternoon. There is no cleaning every 2 hours, wiping down doors, knobs, common area places.
Who's doing the cleaning, staff or patients?
Neither one are doing it. We got some patients that are doing it occasionally just because they're going to be using the specific area. But as far as wiping down doors and doorknobs and common places like
they're supposed to be doing it with bleach or something thereof. I'm not sure about that, but I was told bleach or something, a good chemical that patients can't use. Only staff can use it.
Right.
I think, is that true or not?
When they isolated the people, when they took the people that tested positive off of here, they emptied out the rooms. They wiped out everything. They wiped down the whole thing, and then they had a janitorial staff come in, and they came in and bleached everything and left the room empty for 24 hours before they would let people move back.
I've been told they're supposed to use bleach every 2 hours.
Yeah, they're not.
Could be wrong. Joe, am I right or wrong about that?
No, it's according to their infection control manual. Anytime they go to anything, in fact, even if it's within the hospital, so some of the people are sick, it's supposed to be all across the hospital is supposed to be enhanced cleaning.
Yeah, they're not doing that over here. I mean, we can go to the office and ask
for bleach, Joe, or not?
Bleach is the idea. They have cell block, which actually is mostly supposed to be used on the floor and whatnot. In the AD...
And shouldn't they be providing those green wipes? Because the nurse told me, the head nurse said that's the only thing effective for the virus is the green wipes.
Yeah, they've told us that the green wipes and the blue wipes both work. So if they allow us, we can get access to the blue wipes whenever we want one. We just go up to the office and ask for it, and they'll give us as many as we want.
Okay, the
but if the phone's ringing, by the time you do all that, they're going to hang up. They're not going to stay ringing the phone. So that's a problem. They should be in the day room, the wipes.
Yeah.
The difference between the blue and the green wipes is the blue wipes is alcohol based. The green wipes is I can't remember what it's called, but it's something else. The blue wipes cannot kill viruses. The green wipes can.
Right.
That's why they're only supposed to use the green wipes. But in the AEs on cleaning, like the microwave and the ice machine, it specifically says that the staff has to do it because they have stronger chemicals.
Right. Yeah, well, they're not doing that over here.
Right.
And our ice machine's been broken for months, so they don't have to worry about that.
Okay, is there anybody from Unit 1, 2, or 3 yet? Paul? No? That's a surprise. Okay.
Yeah, as far as the social distancing, you can't do that over here.
I'm very familiar with your unit because I was there a long time ago, and there's not too much reception for the air antenna, so you guys have no
people in here, maybe 1 or 2 channels, maybe 3. But if they had connections in the rooms bedside, then they wouldn't have to come out and socialize and be in the day rooms. And you know, this is being the unit that it is. We have hygienic problems over here and everything else. So,
and so you want people, as many as possible, to stay in their rooms, but it's a little difficult when you don't have. You have a TV, but you don't have nowhere to plug it into, which is kind of ridiculous when you think about it.
Yes. And
all right. How about Unit 10? Are you online yet, sir? Okay. Unit 9. Okay. Unit 18. Are you online? Unit 18. 19.
18 is here, sorry.
18 is here?
Yeah, 18.
Is Boswell or Tom Moore?
Yep, Boswell.
All right, Boswell. Can you report to us what's going on in your unit, please?
Well, we have most of the staff that wear the masks. What they don't do is wear them properly. Probably about between 60 to 80% kind of wear their mask half on, half off.
Right.
We only had like 5 chairs in the entire day room until just this last week. So social distancing, obviously, impossible. We weren't even allowed to go into the day room because there's no seating. Now there's about, I don't know, maybe 12 chairs. Apparently the warehouse is all out, and when the staff on our unit decided that they did not like one of the patients, they moved all of the chairs to the staff lounge area.
Yes.
And they were taken. Right? And so anyways, okay, I don't know, that just messed me up. I was in the middle of talking and there's too much stuff.
Is that coming from your unit or what?
So anyways, the compliance with the masks is very poor because they wear them half on, half off.
Right, that's like not wearing a mask at all.
Chairs, they barely got some chairs in finally because the staff had moved them out and put them in the back room since they didn't like one of the patients. We still don't have our tables back that the staff took from us at the day room because, again, they didn't like one of the patients. And now the new unit supervisor, Lupe, says she doesn't know where any of the chairs or the tables are that the staff took because they all disappeared from the back. And the warehouse is all out of chairs and tables, so kind of makes it a little hard. There's no psychological, emotional, or attitudinal support being offered on the unit. Clinicians are, of course, only here for 2 weeks out of a month, and each week they work 4 days, and so that's 8 days in a month that there is a clinician here. There's no extra activities being offered, nothing like the bowling or, anything like that at all.
Do you have any complaints on the packages?
I'm going to hand it off to Tom real fast, let him kind of take it over.
Before you go, Boswell, is there anybody having complaints about having their packages returned?
Yes.
So you're
I had
having
my
that problem
package
on your
returned
unit as
because
well?
it was less than like 2 ounces over. When
Yeah.
it was ordered from a approved CDC vendor.
Right. Okay.
All right.
Let Tom come in now. Tom?
Sent back, and it was sent from Access.
Yeah,
And we were
who's
having
that
trouble
that just spoke
keeping
just
the
now?
proper chemicals on the Kyvac.
Is this Tom speaking right now?
Huh?
Is this Tom talking right now?
Yeah.
Okay, go ahead, Tom.
Okay. And we haven't been able to get the bleach for the showers at night when they really need to get bleached out with mold in there.
So they're denying you proper chemicals for cleaning?
Yeah.
Okay. How about the staff? Well, he already reported about the staff. We already know that. We don't need you to.
Yeah.
Okay. Anything else, Tom?
Oh, no. That's it.
Okay. Thank you for your time, sir. Is Unit 11 back with us yet, Mike?
Okay. We're going to have the 2 o'clock call for Alameda?
Oh, who's that? Who's talking? Is that Tom?
Yeah.
And you got to call a separate number. That's not this number.
I'll give you a call, okay?
Okay.
All right.
Good. All right, Joe. Okay, let's see. I can't understand. Paul, you on the line yet? All right. Number 20, David. How you doing, David?
Yeah, so there's some things that I need to clarify. So first of all, my biggest question is this. For this facility, there's janitors. I'm not talking about the patients. I'm talking about the staff that were hired to come to work here for 8-hour shifts. How come those janitors that are hired and they're assigned to units are not working on units 8 hours a day? How come they just come to the unit, they dispense paper towels, toilet paper, and they book it? I don't understand why they're not cleaning. They were hired to clean the facility, and then what are they doing when they leave my unit? I mean, if they're just dispensing, paper towels and toilet paper, they don't even dump the trash. So my issue on that is, why is it that they're not cleaning? And why is it somebody told them that they don't have to clean during this time? I don't get that.
Yeah.
The other thing
that's
is...
a good point, David.
Yeah, they're not hired to go sit around in some office when they're done, dispensing paper towels and toilet paper. I mean, that doesn't take very long to do during the day. I've done it when I was at Patton. It's an easiest job as ever. But the fact is they have access to all the cleaning material, and they can be disinfecting areas that, other patients can't, or, they just go behind and just disinfect everything. You can never disinfect too much. My other question is this, with the enhanced cleaning by staff, so what is the policy? Is the policy that staff every 2 hours, it's a written policy that they have to clean every 2 hours no matter what? Even if there are patients that are working and cleaning, they still have the policy that they're supposed to clean every 2 hours? Is that the policy?
Joel, you still online, Joel?
Yeah, I'm still on. On all their things with with the infection control manual, if there's anything like that, they're supposed to clean every 2 hours.
Okay, and my other question is this: what areas are they to clean every 2 hours? Is it just like all tables and chairs and doorknobs?
It's supposed to be all the tables and chairs in all the common areas. It's supposed to be all the doorknobs. It's supposed to be the doors, like where the hands go, all the bathroom stall doors, all the like soap dispensers and all.
Okay, so you can put it on Unit 20. That has never happened. That doesn't happen. I don't have any staff member going around every 2 hours cleaning, period. And my other question is this then. I know when we had norovirus and we had the flu season, you know what? My unit used to smell like bleach. All right? Staff used to go around every 2 hours and used to spray everything down with bleach. Now we're under this pandemic, and I think it's ludicrous that, you know what, I don't even smell any bleach. And we're under a pandemic. And nothing's being taken, I can't say anything's being taken completely serious. Now when the norovirus was around and influenza, you know what, they were cleaning because, you know what, that's what they did. Either because they saw it and they didn't want to get sick themselves, but I don't see that happening at all. I don't see any bleach, and I don't see anything being very much disinfected. I have guys that work on the unit, but you know what? They do hand out cell block, but a lot of times they hand out Windex or, you know, the blue window cleaner. That window cleaner is not a disinfectant.
That's what I was saying.
All right? That thing just cleans the windows. So that's my problem with that on my unit. Mask. My unit, I will hand it to my staff. They do wear the mask. You know what? I also think that now, you know what, if they're giving out face shields, they need to enhance it because it's, you know what, COVID-19's already been in here. It's in here. They probably need to start having them wearing face shields, especially when they are serving meals on the unit. All right? So that's something that needs to be discussed. They've got face shields. They should all just use them. The issue about exchanging gloves, I'm talking about their blue gloves, they need to be taught on how to exchange them rapidly and more often. Anytime that they're serving us the meal and they walk out the day room, they should exchange gloves immediately when they come back, but they don't. I had to really have a sit-down talk with my staff and supervisors, because at one time when they were feeding us, they were handling dirty trays and clean trays at the same time. So, I mean, they're not doing it now, but I imagine in some places they are because, you know what, they don't think ahead. Also, distancing on Unit 20, it's not possible, all right? It's just, this has got to happen. We do our best. You know what, they do feed the unit, hallway B and hallway C at two different times. So, you know, we try to keep less people in the day room when they're eating. But you know what? It's an MDO. You know what? They're going to just drink after each other. They're going to fucking share everything. And, you know, a lot of times my staff doesn't redirect. Another issue that I had to address with staff, I can't understand this one. Medication issue. I've had two different times where staff dispensed in their hand from the bottle medication in their bare hand and then put it into a cup. And at another time I had a staff member dispense in his glove hand from a bottle to a cup. And that's just crazy. It's just totally crazy. All right? It's unsanitary. One other issue is about these masks that we wear and that they have. We only get 2 masks. I guess they can only give us 2 masks. So how does that work out when the weekend rolls around? They can't dispense you a clean mask all weekend long. So, you know, that's an issue. The mask is an issue. Sometimes I don't like on certain staff on how they try to dispense it. You know, where they grab it with one hand and then they're grabbing the other hand with a clean mask. It should be completely separated all the time, not just some of the time. I don't think they understand the policy. And one last thing, guys were asking, and maybe you guys can help me out, it's with the canteen and the grill. So I'm told that they're pretty vague about it, but I'm told like when we're on lockdown like we were because unfortunately Unit 17 had some positive tests. You could only order canteen when your days were allowed to go out, you know, under normal circumstances. But I'm also told that that's not true, that, you know what, when we're on complete lockdown, we can't go anywhere. You are able to put in a canteen request every day that the canteen's open. And I'm also told that, you know what, you should be able to order from the grill as well. Does anybody know that that's true?
Can I answer this? Tim?
Go ahead, Joel.
Okay. The way it goes is when during this whole time when we only have 50 minutes twice a week to go out, yes, you do have the ability. They take down the orders. All the units have this where they take down the orders either to the canteen or to the grill, and it's picked up by the staff. They call the staff and say it's ready, and then they go and pick it up. Renee Pierce on Unit 13, what I understand, okay, the same thing as far as it goes with the package. When you don't have one of your days, there's, the staff in the package room is supposed to be processing them. Renee Pierce, from what I understand, got in trouble by up front because she said, no, we're not going to do it. You have to use it when you go out. So that kind of confirmed it for me, too. Okay?
All right. On the canteen part, my guys up here, if they don't want to go out, they can go ahead and order canteen every day if they want to.
Okay, everybody else on Unit 24, negative. Only on your days out, Mondays and Thursdays, will they pick up your order. Other than that, the answer is no. And when we have our time out, if you run out of time in line, that's it. Tough. So
because there's an actual memo that's out, and the memo states the opposite. So here's the problem we're running into. Staff are making rules as they go.
David and Luna, after the hearing, I'll call you, and I'll give you a phone number of a lady who will help you with that.
All right, thank you.
Those 2 issues, with the canteen and grill, all right? I'll get that.
All right. With no supplies.
You can call her directly, okay?
Yeah. So the last point is that I don't understand why we don't have bleach, and I don't understand why staff's not bleaching the unit.
That's the issue. That's what we're talking about. They're not cleaning every 2 hours. They're not.
No, I don't have any staff cleaning at all. I don't have one staff member going around cleaning 2 hours. I don't smell any bleach. I'm right now sitting in the back room. This back room hasn't been cleaned today.
Okay. Your point is noted.
All right, thank you.
All right, thank you, David. Richard Grinder. Richard, are you online or not? Guess not. He wasn't feeling too well. Let me see. Tom Hall?
Yes, this is Thomas Hall, Unit 25.
Can you give us a report on your staff wearing protective gear, like masks?
Yeah, I have a few points I would like to discuss. Staff definitely not wearing masks. Some of them not wearing masks while they're in the office. I just walked by the unit office a little while ago. We have an acting unit supervisor by the name of Don Irwin. Used to be the shift lead on 26. He was in the office with the face mask off. Our acting shift lead, Yvette, had her face mask wrapped around the bottom of her chin. A lot of good that would do. They wear the same gloves handing out the trays that they wear receiving the trays back. That's cross-contamination. There's definitely not cleaning going on the unit except for the patient's cleaning, and that's not with the proper chemicals. The unit I'm on here is infested with, I don't know if they're water bugs or roaches, ants, flies. It's really nasty. There's no eating anywhere on the unit except for in the day room. And so there's 50 patients, and we're forced to all eat in the day room. They do not separate the unit hallways from eating, so it's more or less all the unit eating at the same time in the day room. It's very crowded. And then they do things like popcorn social, and they say that the patients are not allowed to take the popcorn out of the day room. So if the whole unit decides to do popcorn social, then you've got 50 people in the day room eating popcorn and socializing, which is not distancing at all. It's just all bad. And as far as the packages go, ordered a package from Walking Horse approximately 2 weeks ago. It was returned last Friday, 27.41 ounces. Sent back here, returned again on Tuesday, and then returned again yesterday. Sent back here 3 different times and returned 3 different times, 27.41 ounces.
Okay, I'm back.
I knocked on the office door to request a patient complaint form, and I stood there for 10 minutes while the staff member named Anthony was on the computer. Finally, I walked around the other side of the office and looked through the windows, and he was on some chat site or something with pictures of girls and little chat boxes. And I told him, I said, you know, you're a little dick idiot, man, and I would like a patient complaint form, and I shouldn't have to stand there for 10 minutes. And he said, I'm taking your level for verbal aggression. Okay, take my level for verbal aggression, then I don't care. You know, and I still want my complaint form.
Okay. I had to step away for a minute, Tom. Did you address the issue about your staff wearing masks already?
Yes.
Okay. Sorry, I had to step away.
Okay.
Okay, I think the only one we got left right now is Luna. Are you done, Tom? Excuse me, I'm sorry. Are you done, Tom?
Yeah, one more thing. And as far as the canteen goes, we have had some issues with not being able to order canteen. On Monday, they told us no canteen orders because the hospital was on lockdown, and I called the canteen myself, and they said they were taking orders. So I asked to speak with the program office, and when they asked me why, I told them that the canteen is taking orders and that they're misguiding us and telling us that there was no canteen orders. And ever since, we've been able to put in canteen orders every day.
Okay. All right. Thank you, Tom. Is anybody else that I missed that's online right now?
Daniel Hernandez.
Oh, hi, Cuba. How you doing, buddy?
Doing good.
At 5. Yeah,
I just wanted you guys to know I was listening.
Oh, okay. I didn't know you were there. Yeah, you were in 17, and they tested you. You were having signs and symptoms, right, over there in 17?
Yes.
And then they tested positive, and then you got 2 other people from 17 also, and they're with you in Unit 5 still, right?
Yes. I was the first one here. They didn't really seem to have their protocol straight, even though they had that other guy to begin with, but they're kind of getting it together.
Okay. But I want to bring you back to when you were in 17. Do you have a vivid memory of whether or not staff were wearing masks?
Well, the more that I thought about it, there's been some, of course, that weren't wearing them, but they were in the office, they were in the medication room, things such as that. I actually would remind them to wear it, and in a joking way, but I would remind them to wear it.
Right.
Okay, any other questions? I mean, I don't mean to be rude, but just I have a bunch of answers. I just don't know what questions you may want to ask.
Oh, no. I'm wanting to see if Joel is still there. Joel? No?
Yeah, I'm still here.
Yeah, this is the guy in Unit 5. Do you have anything you want to ask him?
One of the things on the protocol is, you know, the staff is supposed to encourage the patients to wear masks and things like that, or to try to spend time, you know, with the social distancing and that. And, of course, they're supposed to set our examples. Is any of that happening?
In some respects, it's not. Again, there's been occasions when I've noticed them in the office not wearing them. Not here, but in the unit I was previously in, Unit 17. So it was periodic. I would notice them not wearing the mask. Some of them actually expressed that they weren't concerned about getting sick. Things of that sort. They weren't doing any cleaning, that's for sure. I know that much. There was no actual cleaning going on. They pretty much stayed in the office. They would come out and actually socialize and, you know, of course, play cards and such with people and play dominoes. So I got to thinking that's possible how I may have gotten it because of just that interaction, just the socialization. And there wasn't 6 feet. That's clearly the case. There weren't 6 feet.
Okay. One of the other questions I have for you, if you can, please, while you're over on Unit 5, is there's staff that are working one unit, like, we were talking earlier about 17 staff working other regular units that are not quarantined and things. I do know a few days ago on my unit, there was a guy that was working up here, and somebody said, where do you usually work? That's a nice mess. And she said that she usually works on intake in Unit 5. So one thing that if you can make a note is, are you getting a bunch of floaters in there that don't usually work there?
Well, I've been here since last week Thursday, and I've noticed different faces, but then I don't know to connect them with regulars who've just been on their days off or on vacation.
Okay. But
I'll pay closer attention to that.
Yeah, if you can do that, because, obviously you don't know the staff in their units, but if you only see a staff member for a few days and then you don't see them for a long time, obviously, they're usually working somewhere else. But as far as it goes, inside of the nurses' station, I know on my unit I'm off of 16, the staff would rather be like 1.5 feet apart so that they can all be on the computers rather than do social distancing. And the masks are supposed to be worn in the nurses' station because they can, give it to each other. That's just the hospital policy. So even though the staff say, well, we don't have to wear it in here, the case is actually the exact opposite, because that's where it's more likely going to be passed on.
True. For anybody else that's still on the line, I don't know how many there are, but if anybody has any complaints and they witness staff not wearing their mask, please feel free to call me or Joel, or if you want to call the administration yourself. Call us, and we'll relay this to the attorneys involved in trying to force this place to be compliant. You guys have to get word to us, and don't keep it to yourself. We want to know. We're going to do our best to keep everybody safe, including the staff who are refusing to wear the mask. So
I'd like to say real quick on
too.
Property. I'm sorry, I didn't mean to cut you off, but it's important that everybody knows that you cannot take your property with you. You can take nothing with you, and when you leave, anything that you've purchased from the canteen, you can't take back with you. So everybody needs to know that, because I'm sure there's going to be a lot of upset people knowing that they can't bring their property here.
And that's pretty much the same thing with MA1 that I think Joe was alluding to earlier. It's it's a nightmare. And for them to tell you you can't take your property with you after you're done, that's incredible to me.
Yeah, I just actually, for the first time since I've been here, I actually told them now I'm upset. And, it's pretty frustrating because I just spent like $50 on canteen and thinking, and they told me that I can share with the guys here as long as it's not something that I prepare by hand. So I don't know what you guys think of that, but
are you supposed to be there for how long? Did they say anything?
No, they told me. Okay, there's another thing they said, that the 14 days begins from the time that I'm no longer testing positive. So that could be a month, that could be 2 months. They were very clear about that to me the other day. So there's a lot of things that they're telling me now that they should have told me, within the first 72 hours. But, there's so much they haven't told me.
Well, I think they don't want to get you upset is why they're doing that. They're withholding. But that's no excuse at all.
No, it's not.
And have you had any experience before you went to 5, when you were in 17, with people, with the staff returning your packages, or someone getting their packages returned?
So far, no. But I know that here I have packages, and I had just gotten 3 packages, and they said that I can't have them here. I can have Canteen, which comes in the same manner if you think about it. It comes purchasable from outside. It's packaged, and they're saying, no, you can't have any packages here.
That's crazy. Wow.
Yeah. Oh, yeah, they're just, I'm actually the first one since last Monday that they've actually had here in as far as being positive and being here and articulating, actually not complaining, but requesting, advocating for myself. And let's please not leave the 2 MDO guys here that basic in a little bit. And let's see. Okay, so the MDO guys, they don't have a clue. One of them actually spent about 45 minutes in front of the office while I was eating, and Sanchez, and he was trying to communicate something to them, and I don't know what it was, but he went back to sleep, but I'll ask him later, because he clearly had a concern or a complaint, and I'll definitely ask him, and then I'll let Sam know about it.
Okay, the other person there with you is named McDonald, is that correct?
Yes, and he's just so out of it. He has no clue, and he's just staying in his room. I try to get them to come out here and watch TV and socialize with them from a distance, and I want to also share the canteen with them. But, if you guys don't think it's right to do it, then I won't do it. But they said that it was the nurse, the head nurse, she said that I could do it as long as it was packaged.
Yeah, I don't know. I'm not an expert. Joe probably knows more about that. She said
it was cool, so I'm assuming that it's cool. And, I don't know, I'm just trying to make their stay better, man. I mean, I know they must really be miserable because they don't have a clue. They don't have a clue.
Yeah. All right, well, that's why they should have professionals in there giving us some counseling. Obviously, that's not happening.
Right, and they should have things printed out, informational printed out, so that there's no question about what we're expected to get, ask for, or can't have.
Yeah, they're keeping you in the dark.
They really seriously are, and that's irritating. It really is frustrating. Yeah. But, I know that for the sake of you guys, for myself and for you guys, I got to, really keep it together so I can help you guys help me.
Yeah. Yeah, we're gonna see if we can get you some help in there.
Cool. Oh, and I did talk to Amy. I called her, so.
Well, no, they're probably listening. If they're not listening now, they will be.
I have a feeling
this recording is going to be available for them. And Amy's been really good as far as trying to protect us. She's not just protecting San Diego people, she's protecting us as patients, period.
Cool.
So she's really done a lot.
Okay, so this recording will come into evidence at some point down the road?
It's there. It's available. I'm going to give you a number to call. It's an access code number that anybody can listen to this whole recording. So It's already been an hour and a half now, so I think we're going to...
Okay, I'll let you guys go.
Report, and then we're going to tie it up unless somebody else gets online, but I don't see that happening. So, Luna, are you ready? You got anything to say?
Brother, I have a half a dozen issues for the COVID-19 on Unit 24, including the fact that the staff have done no disinfecting for over 5 months. None of any kind. I take no naps. I'm wide awake. I was there since May 8th of 2019 until last night. I've been transferred to Unit 23. Now, for over 5 months, they won't do any disinfecting of any kind while sitting in the office, streamlining movies, TV shows, cartoons, sporting events, and shopping for women's dresses, women's shoes, and they don't come out of the office and disinfect anything, not for over 5 months. So I got stuff like that, including guys in wheelchairs. It's an upstairs unit. But Sam, you had me on hold since 1,300 hours. I need to utilize the lavatory, the urinal, and then wash my hands. Can you give me a minute and a half?
Yeah, go ahead. Go ahead.
Okay, I got shocking stuff for you. I'll be back.
Sorry about
that. You want to give me that number so I can listen? Sam?
You mean now or later?
I don't want to take up this important time. Yeah, you could call me. And I don't want to stay on much longer, but I'm kind of having trouble breathing. I was going to go lay back down, but then I miss my phone calls if I'm in my room. So I asked them if I could lay down. They said I can't lay down, or lay down on the chairs. So I'm going to go lay down for a while.
Okay.
And
all right. This is Luna again, right?
No, this is Daniel Hernandez.
Oh, Daniel, no, we're tying it up. You can get a recording of this later. I'll make it available for everybody. So
okay, cool.
Thank you for your time. And if we need any questions answered, if the lawyers will call you, believe me. Somebody's going to call you, Hernandez.
Okay, sure. I'll be ready.
All right, buddy. Take care.
Right,
God bless. And thanks for everybody for helping. Is there anybody on the line that we missed that showed up late? I don't think anybody's with me. Larry Lowe, you still there?
Hey, Sam, can I say something real quick?
Go ahead.
One of the things about the packages, we get a total of basically one package a month.
Right.
And one of the problems that we have is they've not only limited the weight, they've limited the size. So if say I do an order or my family does an order with Walmart and they break it down into 4 different packages, that is the only thing I get for the next 4 months.
Yeah.
Or they start turning it back.
That's a big issue. But the bigger issue is us not getting the package because they're sending them back under false pretenses.
And we cannot control what size the vendor uses. Right. I had 2 packages last month that got turned back because they were 2 inches too
Once we get a law firm who's listening to this is willing to help us, and a lot of that stuff is going to come out. So just be patient with that, Joel. But your point's taken, though. A lot of us are going through that stress as well. And Brandon has caused us so much stress with these packages. It's a wonder that we haven't become real mental patients. Stressed out so much over these packages, and it's got to stop. Somebody's got to come to our rescue and put a stop to it. So hopefully somebody's listening and will take an interest. Okay, Luna, you want to finish up?
Yes. Okay, so I have 7 items for the COVID-19 issue. 6 of them are for Unit 24. I just transferred from 24 last night to 23. And for the last over 5 months now, there is no disinfecting by the unit staff of any kind. I take no naps. I'm wide awake watching everything. I have complained to them about not disinfecting the doorknobs of the rooms, and they just roll their eyes at me. They sit in the office,
they're in the office on the computer, on the internet?
Yes, on the computers in the office. They
tell if they're on the internet or not?
Fish tanks. Pardon?
Can you tell if they're shopping on the internet?
Say that again?
Can you tell if they are shopping on the internet?
Affirmative. There's women's dresses on the computer screen. There's women's shoes on the computer screen. There's women in scantily clad bikinis that the men are watching. I mean, women barely wearing anything. The skimpiest bikinis you could imagine. The men are doing that. The women are shopping for dresses, in shoes.
All right. I just
watching movies.
Luna, I just wanted you to answer that question. I'm going to go forward with that, but I just need an answer to that question because they're not allowed to do that. Okay. So cover the other issues because we got to end this pretty quickly because it's getting way past the hour. Go ahead.
So
finish up your report.
Okay, so patients write to me over the phone over 5 months ago that the staff are required to disinfect our door handles. And they asked me if that was happening. I said yes. It only lasted for about 2 weeks. They were only doing the outside of the doorknobs. I protested this, and they said, well, they don't want to disturb the patients by doing the inside doorknobs. 2 weeks later, they quit doing the outside, and for over 5 months, there's no disinfecting by the staff of any kind.
Okay.
Not the telephones,
anything else?
The doors, the furniture.
How about masks? Are they all wearing masks in 24?
Yes, except for in the med. Now, in the med room, it's hit and miss. 50% of the time they wear the mask because they're behind the glass. They think they don't need to, but they touch the dirty broom and dustpan in the med room and with bare hands, and then start handling everybody's medications with bare hands. And I was like, my God, what are you doing? They handle the charts in the office, touching everything, doorknobs. The food cart shows up. Without changing their gloves, they start passing out all the food trays. After working in the office with the broom, the dustpan, the charts, the writing pens, they will not change their gloves before handing out the food trays. So it's a death trap. These guys in wheelchairs who cannot use the stairwell. I've been on 2 different units where there was a fire, and they were both upstairs.
Yeah, and that issue by itself, I have an attorney that's going to be listening to this, and he's with the law firm, and he's going to be probably calling you about that. So just go ahead and go to the next item.
Okay, the bathrooms don't get disinfected for several days at a time. The showers don't get disinfected for a week to a week and a half at a time. There's blood all over the toilet seats. One guy's bleeding internally. The shift lead argues with me for over 10 minutes about the blood on several toilet seats, telling us to use a different toilet. But there's like 40-something guys and 6 toilets with 3 of them with blood. And they want to argue with me about it and refuse to do anything about the blood. And when I said I'm going to call licensing if you don't do something, then he gets on the phone, calls the treatment room. The RN comes out, uses cell block on the blood with toilet paper to wipe it. And I don't think cell block is the proper chemical for blood. I think Virex is. But I have to argue with them for over 10 minutes about all the blood. And like I said, they won't clean the bathroom at all for several days at a time. There's no IT workers willing to do it, and the staff won't do it. And same thing with the shower. It's so incredibly filthy. I ended up springing into action for the last 3 weeks and started getting the cell block and disinfecting the phones, the tables, the chairs, in the day room, the quiet room, the sports room, the microwave, the ice machine, the counter, the refrigerator, because I realized that if I don't do it, it's not going to get done. And I even tell the staff, if I don't do it, and they complete my sentence, it's not going to get done. They mock the fact that I was the only one doing it for free to try to save these guys' lives. So now that I'm gone, nobody's doing it.
Yeah.
And
so any other items blown up before we tie it up? And
okay, so next is, okay, the guys in the wheelchairs. Now, they made a threat to myself and 2 of the patients on Unit 24 yesterday. They said that everybody on 24 is being transferred to other facilities, but you have to take the COVID-19 test in order to be transferred out. 3 of us don't want to leave this facility, so we refuse to take the test. So they brought gray bins to our rooms and said, pack up, you're going to T5. I said, wait a minute, that's attempted murder. Those guys are infected with a deadly virus. And they said, well, you won't take the test.
They were just trying to manipulate you. They weren't going to send you to 5.
Yeah, so 2 of the patients got scared for their lives and took the COVID-19 testing after saying, I don't want to do it, as their constitutional right to refuse medical treatment because we don't want to leave the facility. I was the only one who wouldn't turn the wheel at this game of chicken. So my people called the DPS over the phone. The DPS came to see me. They transferred me to Unit 23 for refusing to take the COVID test. The DPS and the U.S. on this unit finally told me, you're not going to T5. My people from the streets called and said, look, this is attempted murder. You're going to get these guys killed. And so they swore up and down that we're going to T5 yesterday. And that they were
just trying to trick you into taking the test. That's all they weren't going to send you to T5. Don't even think like that. What's going to happen?
Well, they swore we were going. And I was the only one who wouldn't turn the wheel in this deadly game.
They might send you MA1 for isolation. That's about the worst they're going to do, which is bad enough anyway.
But even then, that's bad.
All right, we got to tie this up.
the guys who get chronically sick.
Hey, Sam?
They may want to set aside for people that are being tested for possible...
Hey, Sam?
Yeah.
Listen to me. This is Jeff with DSH Abuse. I've listened to this call, and I think you've done a fairly good job. I think we've missed a couple issues, but I need to tell you what to do here. You need to call the police, and you need to do a police report. We're going to put this... I want to put this up on YouTube later today. I think you've done a fairly... listen, I think you've done a fairly good job here. This needs to be put on YouTube immediately so that it can be made available. This is an emergency. What some of these men are reporting is an extreme emergency. These men need to be interviewed by investigators. What's being reported here, as I said, I think you've done a fairly good job.
The point is,
Sam?
I was going to contact you anyways.
Sam, hold on a second. Let me interrupt here because everybody's phones are going to die, and I want to say something. As the person who moderated this call, you need to call DPS immediately because you have the access to the MP3 file. You need to call as soon as you hang up. You need to call DPS and file a police report. To file a criminal report for what all these men have reported, the failure to clean these units. That's a police report. We need to call David Starnes, the Chief of Law Enforcement, before the end of the day, before 4 o'clock. You need to get Amy and Mr. Lynch to contact DSH Legal to have all these men interviewed that they're not cleaning these units. We're going into the weekend. I'm going to try to get my people to put this on YouTube. So it'll be accessible. They need to move on this immediately. I need to get off this call, but hopefully you can wrap. But we need this guy who's reporting this stuff right now. Everybody needs to move on this immediately. I filed emails earlier today.
I wouldn't let him say it right now. He's going to contact somebody else.
But listen, we filed an email right before this call. About staff were calling me about that they're running into units without PPE. One of the issues in terms of responding to these alarms, every staff should be wearing PPE at all times so that when they run to an alarm, they can take that PPE off before they return to their home units. So go ahead and do this. I'm going to get my guy and try to put this up on YouTube. I'll call you after the call. I got to get off now. All right.
Joel, Sam, this is Luna. I still have one more item.
All right, go ahead.
Okay, so like I said, I've been moved to 24. You were saying about the stress level for everybody. Well, the unit has 2 TVs. One of them's been broken for 3 months. So it's difficult to follow the COVID-19 information on the TV news. There's blue painter's tape wrapped around the cable for one of the TVs to no avail. It's been broken with no picture and no sound for 3 months. And the guys have been pleading to get it fixed, and nothing will be done. So that's stress.
I know. I have information on that. The person whose job it is to take care of that is out sick, and also there's no other TV to replace. We're having this problem elsewhere. So, but we'll follow up on that. We will follow up on that. All right, buddy. Okay, we're going to end this.
The staff on 24 seem to be doing a pretty good job. Everybody wears a mask. They seem to be doing a pretty good job on this unit. Or 23.
I'm on 23 now.
Yeah, I'm on 23 now. And the staff seem to be doing a pretty good job. Everybody wears a mask at all times, and they seem to be doing pretty good. They seem to be kind towards everybody.
Thank you for that report.
They're doing a lot better. The staff on 23 is doing a lot better.
And I will make this recording available to anybody that wants it. And believe me, we will get a response. They are going to do their job one way or another, or they will have to go somewhere else to work. They have to do. We're not going to die because somebody doesn't want to wear a mask. Okay, Joel, are you still there? You must have hung up. All right. All right, this conference call is over. The time is 14:46, 2:46 p.m. Thank you for everybody that participated. Hopefully this will be helpful soon.
Thank you.